Hi everyone, welcome to my Isoflow movement demonstration series. Today we're focusing on hip flexors. So why this movement first? The hip flexors are the #1 problem for desk workers. They're the root cause of most back pain. Releasing them creates immediate relief, and this is the quick win that proves the method works. Today I'm going to show you the single most important movement for anyone who sits at a desk all day. This is called the couch stretch, and if you can only do one thing for your back pain, make it this one. I'm going to show you exactly how to do it and what you should feel and the mistakes to avoid. So let's go. I know I called it the couch stretch. You need a couch, a bed, or even a chair, something stable that's about this high. I'm going to use this split squat bench because, well, I have one and it's easier than moving a couch into my treatment room. So first thing we need to do is get into position. So I'm going to kneel down and put my right knee on the ground close to the couch. Then I'm going to take my right foot and prop it up on the couch behind me. If you're anything like me and you do have the world's knobbiest knees, then please pop a towel, just like I have, under your knee for comfort. So my right shin is vertical against what would be the couch. My right knee is on the ground and my left foot is planted in front of me. From the side, you can see my back leg is in this position. If this is too intense, you can move your knee further away from the couch. And if you want more of a stretch, you can obviously move it a little bit closer. Now we're in this position, this is the teaching part. I'm going to put my hands on my front thigh for support and for balance. And here's the key. I'm going to squeeze my right glute. That's the one with the leg that's stretched, not the one that legs in front. This glute here. And you're going to squeeze it as hard as you can. Then I'm going to gently start to push my hips forwards. And you should feel a stretch right there. Here's what you should not feel. You should not feel pain in your lower back. If you do, you're arching your back too much. Tuck your pelvis slightly and squeeze that glute harder. You should not feel sharp pain in your knee. If you do, put a towel or pillow under your knee, as I've demonstrated before. What you should feel is a deep stretch in the front of your hip and possibly down the front of your quad too, that's the front thigh. It should be intense but not painful, like to a 6 to a 7 out of 10. Hold this for 2 minutes. I know 2 minutes sounds too long, but this is an isometric hold and your hip flexors need time to get the message. While we hold this, I want you to focus on 3 things. 1, keep breathing. I don't want you to worry about deep breaths in through your nose and out through your mouth thing. I just want you to breathe deeply and naturally. Don't hold your breath. 2, keep squeezing that glute. All this time, I've been squeezing. All the time I've been talking to you, I've been squeezing. This is important because when you activate your glute, it tells your hip flexor to relax. This is something called reciprocal inhibition. It's a fancy term for they can't both squeeze at the same time. 3, slight adjustments. You can gently rock forwards and backwards slightly to find that sweet spot. You might find it released a little bit and then you can go a bit deeper. And you might feel some burning, that's normal. You might feel it in different spots, different parts of the muscles release, that's normal too. You've got about 30 seconds left. You might be feeling the urge to come out of this right now. Please stay with it. This is where the real change happens. Okay, 2 minutes are up, so now we're going to slowly come out of it. So we're going to come out of it in the reverse way that we came into it. So you're just going to lean back, take your hands to the floor. If you need to bring your supporting leg round, you can, and then just bring your other leg down. Now here's the really cool part. Stand up and notice how your right side feels compared to your left. My right hip feels more open, my leg feels longer, it almost feels like it's floating. I can stand up straighter on this side without forcing it, and that's the difference between a released hip flexor. That's the difference between a released hip flexor and a tight one. Now we're going to do the other side. If you need to help your leg out with the other hand, that's absolutely fine. Left knee down, left foot up on the couch. Key points, remember, squeeze the glute. Push the hips forward gently and keep breathing, no lower back pain. I'm going to hold for this for 2 minutes, but I'll spare you the real-time version. The key is to stay consistent with that glute squeeze and keep breathing. The most common mistakes I see people make with this stretch. Mistake number 1, arching your lower back. Don't do this. Instead, squeeze the glute first, which tips your pelvis slightly, then move forward. Mistake number 2, not holding long enough. A lot of people do this for 30 seconds and wonder why it doesn't work. Your hip flexors have been short for months or even years. They need time to get the message. Mistake number 3, forcing it. This should not be painful. It should be intense, definitely not painful. If you're grimacing, can't breathe, you've gone too deep. Start where you can maintain the position with good form for the full 2 minutes. You can always go deeper as you get better at it. So when should you do this? Ideally, do this once in the morning and once in the evening. Morning gets your hips open before you start sitting all day long. Evening releases the tightness that built up during the day, but honestly, even once a day will make a huge difference. You can do this while watching TV, while on the phone, or while your coffee's brewing. There's no excuse not to do this. You're just not kneeling there. You can just literally do anything else while you're holding it. Read a book, listen to music, watch the television. So here's what I want you to do. Do this stretch every single day for 1 week. Just 1 week. Set a reminder on your phone and make it a non-negotiable. By day 3, your hips will feel more open, and by day 5, you'll notice that you're sitting up straighter without even trying. By day 7, that constant lower backache will be significantly reduced or even gone. I know it sounds simple. It is simple, but simple doesn't mean easy. Simple means you'll actually do it. This works if you do it consistently. Alright, that's the couch stretch, your new best friend for hip flexor release. Drop a comment below, tell me how long you've been dealing with tight hips or lower back pain, and after you try this, let me know how it feels. If you want more Isoflow movements like this, hit the subscribe button. Next video, I'm going to show you how to wake up those sleeping glutes, because releasing your hip flexors is only part of the equation. Thank you for watching, and I'll see you in the next one.